From Eyewitness News, this is Newsmakers.
Bracing for a possible pandemic, the world watches and waits as COVID-19, the coronavirus, continues to spread. More than 24 people have self-quarantined in Rhode Island after a recent trip to China. Is it a matter of when, not if, the virus hits southern New England? And is our healthcare system ready? Our guest on the first half of Newsmakers, Rhode Island Department of Health Director Dr. Nicole Alexander-Scott. Welcome to Newsmakers. I'm Tim White. On the second half of the program, we will be joined by Dr. Adam Levine from Brown University and Dr. Selim Sooner from Rhode Island Hospital, and we will be answering some of your viewer questions. Joining me now on the program is Eyewitness News reporter Ted Nesi. Dr. Nicole Alexander-Scott from the Department of Health, thank you very much for joining us on the program. I know you are very busy, so we appreciate your time. First, a disclosure to our viewers. We are taping this program on a Friday morning, and you may be watching it on Saturday or Sunday, so this information is very fluid. But I'd like to ask you the question I posed at the top of the show, which is it a matter of when, not if, the coronavirus arrives in Rhode Island from your perspective?
We currently have no cases in Rhode Island, but we are absolutely preparing for having cases. We are preparing for it being when and not if. We want to make sure that everyone understands what they can do, because people can. And a real grounder for this is what people need to do with the flu. You know, as we think about this, we recognize that there are unknowns here for all of us, and that can be scary. But we want to make sure that we're putting out information that helps people understand and process this, so that there can be no panic as we prepare.
At the most basic level, Dr. Alexander-Scott, people are seeing a ton of talk about coronavirus. They see the headlines, they get nervous. What is making this something that's getting more attention from public health officials than, I know flu is always a concern, but obviously this is a little different. Can you just in layman's terms explain why it's something that has become such a priority?
Yes, the reason why this gets the attention is because this is a new type of coronavirus. So it's one that none of us have been exposed to before. With the flu, with other types of coronaviruses, which causes the common cold most of the time, people have been exposed to it. There is a level of immunity in the community. We try to say with flu, let that immunity be you getting your flu vaccine so that you are protected and the people around you are protected. Even by you getting your own flu vaccine, that helps protect the people around you. With coronavirus, similar to H1N1, the type of influenza that occurred in 2009, it was a new type of virus that no one had experienced before. And so without that immunity in the community, either from people having the infection or from being vaccinated, there is potential for the virus to impact more people.
And what would be the sign that someone might have somehow gotten it? You know, what are the main symptoms that doctors are seeing in other parts of the world that they say, okay, this is someone we're going to test?
An important part for us as I go through the symptoms is understanding that the travel and connected to a place where there are cases is what distinguishes this may be coronavirus versus influenza or something else. That's because the symptoms are similar. You can have fever, you can have cough, respiratory symptoms associated with it, body aches, and other changes. And so the association with someone traveling to a place where they are exposed to coronavirus is what makes the distinction. And that's why our healthcare providers across the state are well informed about making sure to ask a travel history.
You'd said earlier this week that a couple of people were tested for the coronavirus in Rhode Island, but since then we've learned that the CDC tests were not necessarily reliable. Are you confident in the results of the tests that happened here? And do we have enough of the testing kits in this state if the coronavirus were to arrive, or if we have a lot of suspicion that it could be here?
Those great questions allow me to make some clarifications with that. There are enough tests that are reliable that are being done. Right now, they are being done at the Centers for Disease Control and Prevention. They have expanded their capacity so that they are able to run the tests accurately and confidently. And they are doing it in a quicker turnaround time, so within a 24-hour or so period, occasionally 48, but making sure that there is no backlog of testing. The challenges with the test had occurred when CDC was attempting to make it so that states had the test before us. So that we could do the tests here as opposed to sending it to Atlanta to be tested. We are continuing to work with them on that because we needed to do some validations. Nationwide, all of the states were having issues, and so CDC is working on improving that so that the states could have it. But we are testing, we are confident in the tests, and it's being done by being sent to the CDC with a quick turnaround.
All right, we're going to get to some viewer questions right now. Before you came on the program and our guest for the second half, we went on social media and let everyone know you're coming on, and we got a lot of questions. Which is not a surprise. This first one on Twitter from Josue, he is asking, does Rhode Island have or are planning to establish a quarantine center for infected patients? So to expand on Josue's question here, are there discussions on where or how the state would set up a large treatment facility if we get hit hard?
So we're absolutely considering all of the elements of this response. One of the key messages that we're continuing is if someone is ill, the potential to be able to stay home is also possible. It's not automatic that someone would have to go to a facility separate from it being a hospital if someone were to need it. We would only want people in the hospital that really need it. 80% or so of those who become ill with coronavirus internationally have mild illness, which means people can actually stay home. Quarantining means someone does not have any symptoms, and we're monitoring them to see if they have any symptoms. So we would not set up a quarantine facility because those people can stay home with no symptoms and minimize their travel. Isolation occurs when you do need to keep someone in a particular area who is experiencing symptoms. And we are considering the different types of isolation that will be possible. If someone is ill enough, and only if, which is a key so that we can really preserve the healthcare system for where we need it, we would want someone to be in the hospital isolated. But the majority of cases may not need that to happen. Similar to the flu, oftentimes people are home with the flu. We want people to be equipped with the understanding that if someone is not feeling well, particularly if they've traveled or have been exposed to someone who has traveled, but even with flu season, which is a key part to the message, stay home if you're not feeling well. We want employers to work with their employees to allow that to happen, or to allow someone to stay home to care for a family member who is ill, or think about teleworking policies and others. And if someone is just monitoring themselves without having any symptoms, they can figure out ways to work with their healthcare provider to make a determination about whether or not they can continue to stay home and just be monitored in communication with us at the Department of Health, as opposed to going into the healthcare facility.
Talking about healthcare facilities, one concern I've heard brought up repeatedly is about, and topic you and I have discussed before, the closure of Memorial Hospital. And is there enough capacity, particularly in Providence and Blackstone Valley? No, we already hear about emergency rooms being overstretched. Lifespan says it all the time about the Miriam. We've seen diversions. Are you concerned about how the ERs, especially in that part of the state, would be able to handle a surge in patients if there was some kind of outbreak?
That's a natural consideration with or without coronavirus. How do we make sure that our healthcare systems have what they need? We've seen from the report on how the community was impacted that although there was not a significant inpatient census there was active use of the emergency department. So we really want to work with our healthcare facilities, but then also work with the public to encourage people. If they don't feel significantly ill, you don't have to go to the emergency room. We want to really preserve the hospital and ER facilities for people who are significantly ill, need oxygen, need some additional type of support. If it's something that you can manage at home in communication with a healthcare provider, that is particularly ideal, especially as we start to think about and prepare for coronavirus. We want people to understand the benefit of staying home as opposed to going to a healthcare facility where there's more people at risk
So
of
do you
being
think
exposed.
part of the problem with Miriam being overstretched in particular, as well as the other hospitals, is just still too many people going who don't necessarily need emergency room care?
We have recognized that that is an important message that we need to raise awareness about. There are people that don't need to necessarily go, and particularly when fear occurs and there are unknowns, that's the number one place people tend to go. And we want to try to change that and help people understand how they can take care of themselves at home, and how staying home is a better place sometimes. It's not always good to go into the hospital, and we want to really preserve the hospital for those who are severely ill and who need it. It's a similar message for masks. Personal protective equipment. Many people are seeing on the media that people are wearing masks. We really want to preserve the personal protective equipment for people who need it, who are actually ill and showing symptoms. Just wearing a mask in the community, Centers for Disease Control and Prevention is not saying that that will make a difference. And the importance of maintaining our storage and amount of masks available is critical. We want to make sure that it's available for the people who need it, for the healthcare providers who need it. And any healthcare providers or even public who are not caring for people who are ill do not need to wear a mask, and everyone needs to help us make sure we have enough for those who need it.
And we get a lot of questions from our viewers on masks. We're going to ask our second half guests a couple of questions about that. I want to wrap up our segment with you with this one. You have been telling everybody to, prepare, not panic. How are you personally preparing, looking ahead to the coming months?
That's a great question. Staying calm, taking deep breaths is the key, indeed. Making sure that my family is vaccinated against the flu. That's a big message I have been talking about and promoting. Making sure that we have the ability to stay home if we're ill and have
enough food,
laundry services, all of the things that you would need to be able to stay home in those situations. People are talking about that 2-week window given the incubation period. So encouraging people and my own family to think about what would we need if someone were to become sick and we needed to stay home to help do that, to care for the children in your family or the seniors in your family. So just thinking about those around you and your community, how to support each other, how to be kind to each other in this time of unknown. It's really about taking a deep breath, doing what you need to prepare, knowing we've been here in some aspects in the past. We had a pandemic in 2001 with H1N1, and people made it through, and doing what we can to support each other through this.
Dr. Nicole Alexander-Scott from the Department of Health, thank you very much for joining us. On the second half, we're going to go to more of your viewer questions, and our guests will be Dr. Adam Levine from Brown University and Dr. Selim Sooner from Rhode Island Hospital. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. Joining me, of course, my colleague, eyewitness news reporter Ted Nesi, and our guest from the second half, we have Dr. Adam Levine. He's the director for the Center of Human Rights and Humanitarian Studies and director of Division of Global Emergency Medicine, both at Brown University, and Dr. Selim Sooner at Rhode Island Hospital. He's the director of Disaster Medicine and Emergency Preparedness at Rhode Island Hospital. Gentlemen, thank you very much for joining us on the program. Before we get to some viewer questions, I want to ask this one. I was listening to a podcast by the New York Times called The Daily, and a big topic of that, as they were discussing the coronavirus, was the virus is expected to go dormant in the summer. Dr. Levine, I'll put this question to you, then reemerge, possibly with more force in the fall. Is that what happens with these types of viruses? They sort of go dormant in hot weather, and then they may come back when things cool off?
Well, I would say I don't think we know enough about the virus at this point to make that prediction for certain, but we do know that with other types of respiratory infections like influenza, there certainly is a seasonal pattern, and what we see is during the Northern Hemisphere winter months, a resurgence of the disease, and then during the summer it declines in the Northern Hemisphere, but then surges in the Southern Hemisphere. And that pattern of back and forth is seen with a number of respiratory diseases and possibly could be true of this new coronavirus as well.
So we don't know enough about this one. Will we not really know if this is the case until the fall, and all of a sudden we see it come back, or are we going to learn a little bit more about the virus as we approach the summer?
Well, we'll probably be able to see also how the numbers are looking in the Southern Hemisphere over the course of our summer and their winter. I mean, right now what we do with influenza is we actually use circulating strains in the Southern Hemisphere to develop our vaccine for the following season, winter season in the Northern Hemisphere. And so we can learn a lot from global patterns of disease in terms of whether we might see it continue next winter season.
Dr. Sooner, you know, most people watching home will not be doctors. We're not doctors. And so part of what I think regular folks want to know is kind of how does this look to a doctor, to someone who has expertise? I mean, how concerned are you personally with your experience about this overall? And I guess what is the biggest concern you have about this whole situation?
So with infectious diseases, you know, we see this pattern every year. We don't know what the next flu season is going to be like. Some years it's very heavy, other years it's a light flu season. This year it's a pretty heavy one. So we go through this cycle yearly in terms of preparing our staff and hospitals for the flu season, making sure everybody's getting vaccinated, making sure we have enough masks, preparing our surge plans in case we need to admit lots of people with severe illness. And this is a little bit different because it's a novel virus. It may have characteristics that are different from the viruses we know of. And the scope of this may turn out to be much larger. And we don't know that yet. There's no need to panic currently, but it's wise to start preparing, and that's what we've done.
Dr. Levine, talk about the biology of the virus. I mean, what happens to people? And you know, Dr. Alexander-Scott addressed it on the first half. Coronavirus is actually in part of the common cold. What makes COVID-19 different? And is it really the viral pneumonia that could result from that infection that's the most concerning aspect of it?
Well, when you have any type of infectious disease, the characteristics about it that we care most about are how contagious it is, how easy it is to spread from person to person, and then how severe the illness is in the average individual who gets it. And what we have with this virus is one that is spreading person to person similarly to other respiratory infections that we're used to, like influenza. Probably on average each person infects 2 to 3 other people. However, it does look like the severity of the disease is higher than for influenza, in that somewhere between 2%, 3% of people who are infected with it, at least from the early data we have from China, have died from the disease.
And what's the flu mortality?
It's about, in the United States, 0.1%. Now, it's important to understand that those numbers are affected a lot by the healthcare system itself, and also by how well you know how many people have the disease. So there's probably a large number of people in China who have the disease but weren't ever tested for it.
And a large number of men in China smoke, right? Something like 80% of the population. That has to have an impact on that.
Exactly. And so if you have pre-existing respiratory conditions, if you're elderly, you're going to be more at risk for dying from the disease. But that mortality of 2% is probably much lower even in China, just because we don't know how many total people were actually infected with the disease. We just know how many people died and how many people were sick enough to come into the hospital and get a test. So I think we have to put it a little bit in perspective. It probably is more severe than flu, but probably not as severe as the reports that we're seeing.
We're going to go to a viewer question, and Dr. Sooner will put this one to you. And we got quite a few of this question actually, but we'll go with Mike on Twitter. He sent to us, how confident are they, meaning you, our guests, that it can't be transmitted via packages sent here from China? Can someone get this virus if something is shipped to them from China?
So there are some data that show that this virus can survive on surfaces, particularly metal surfaces, and if you touch that metal surface, you may be contaminated, and then if you touch your face or mouth, that you may get infected. However, a package that has traveled through the postal system from China it's very unlikely that any viral particles would survive that trip.
Based on time,
Based on time, environmental conditions, they're up in airplanes, the temperature variations, UV radiation, it's very unlikely. And I'm not aware of any reports of anybody getting contaminated or getting the disease from packages.
I'll stick with you for this one, Dr. Sooner. Another viewer question. This one is from Jerry. He asked, and we talked about masks in the first half with Dr. Nicole Alexander-Scott. He said, is it effective to wear a common dust mask? Also, is it true that a surgical mask is not necessary nor helpful?
I'll start with the second part first. A mask is just a barrier. The mask that healthcare providers wear when taking care of patients, they're specialized masks that were fitted for, but the population wearing masks that we see on TV in the streets, those are common surgical masks, and they're just a barrier. They do protect the mouth and nose from particulates in the air. However, it has not been shown that they prevent disease, because it's not just the mask, it's not just your mouth or nose. You can contaminate yourself by touching your eyes, not washing your hands. So it's the whole package that's really protective. Washing hands and not touching the face goes a long way and much farther away than wearing a mask.
Dr. Levine, a question for you. You've studied Ebola and other pandemics, epidemics. What are you going to be watching in the coming days, weeks maybe, to decide either, oh good, this is not quite as bad as we feared it might be, or all right, this is quite serious? I mean, what as we try to make sense of the news, what will you be watching?
I think I would say, number one, it is quite serious already. But number two, that doesn't mean that we need to panic. It's very likely, based on what we're seeing, that we're going to have sustained transmission in multiple different countries. And so that sets this up for being a pandemic. People should not freak out necessarily when that's declared, because of the fact that we deal with pandemics all the time. We have pandemic flu every single year, basically, and we have a number of other diseases that are widespread across the world that we handle and we manage. The key is going to be for the individual healthcare systems to be able to set up plans for being prepared for screening for the disease, for testing for it, and for treating people who have it. The problem will be mostly in those countries that have weak healthcare systems. Especially, I worry about countries in sub-Saharan Africa, in South Asia, and other parts of the world that don't have as strong healthcare systems and don't have as much redundancy in their healthcare system as we do here. And so that's why we really need to think about how, as a country, we're going to help support those other countries in order to reduce the transmission of disease there, and in turn help us by reducing disease coming back to the U.S.
Dr. Sooner, from a hospital perspective, one of the great differences between, say, the Spanish flu of 1918 to if it were ever to get that big here is we have a much improved medical facilities around us, but respirators are needed if it gets to be that severe. Do our hospitals have enough respirators right now if we were to get hit very hard with this and patients were in need of those?
So starting with the first reports coming out of China, our hospital system, Rhode Island Hospital and Lifespan, has been asking those type of questions on a weekly basis. We meet and discuss our supplies, our equipment, how do we protect our workforce, what kind of personal protective equipment do we need, what kind of protocols are we developing if someone comes in with the suspicion of COVID-19. We get all the experts into a room. We have a task force dedicated just for these questions.
Do one last viewer question, and I'll pose this to you, Dr. Levine. We saw the stock for Clorox bleach go through the roof, and I think this applies here. MJ emailed this one in. What cleaning agents do you need to kill the virus? Specifically asking about Clorox wipes or those Lysol wipes. Obviously, bleach, soap, and water. Do those Clorox wipes work to kill the virus?
So certainly all of those would be effective to kill this virus and all others that we have circulating right now. simply washing your hands with soap and water is also incredibly effective. Using alcohol-based hand sanitizers like Purell, also very effective. I think that for the most part, this disease is transmitted by respiratory droplets or contact, and so it's really our hands and our face that we have to worry the most about.
But with cleaning surfaces, again, I think that's what that question meant. The Clorox wipes would work,
They
would be
very
effective.
Yes.
Okay.
But also cleaning the surface with soap and water would be effective too.
Less than a minute left. I would even say 30 seconds. Dr. Sooner, I'll ask you the question I asked the director in the first half. How are you preparing personally?
Well, I'm doing some of the similar things that the director has been doing, particularly with elderly patients, parents, uncles, aunts. I'm making sure they have enough medications in the house, enough food, so that if they do need to stay in the house, that they're prepared to do that. And also, stocking up on some stuff in case I need to stay home if my wife is feeling ill.
All right, we have to go. We're going to continue this conversation on WPRI.com. For Ted Nesi, I'm Tim White. We'll see you next week on Newsmakers. Hi, everybody. Welcome to WPRI.com. I'm Tim White, along with my colleague Ted Nesi. We are continuing our conversation from Newsmakers on the coronavirus because we had so many viewer questions we didn't get to them on the show. And Dr. Adam Levine from Brown University has been kind enough to stay with us for the next few minutes to get to some of those questions. He is the director for the Center of Human Rights and Humanitarian Studies and the director of Division of Global Emergency Medicine at Brown University. Dr. Levine, thanks for sticking around with us. Before we get to the viewer questions that I referenced there, I want to ask you kind of a broad question about the country's response or preparedness, I guess is a better way to put it. There's been some criticism of how well prepared the federal government is right now. Are you satisfied with how the federal government is handling this, or do you have concerns?
Well, I mean, I think that the CDC has been taking, very reasonable steps to respond to this epidemic so far since it began. And I think it's filled with very smart and very capable people that are doing an excellent job. That being said, they're dealing with the fact that the CDC has been reduced in size and funding over the last 3 years. And as a result of that, they don't have the full capacity that they need to respond, not just here in the US, but especially globally. And of course, when you're dealing with a pandemic, you have to think not just about your domestic response, but the global response, because we're all connected together. And a bad outbreak of the disease in a country in sub-Saharan Africa or a country in Latin America is going to feed back and worsen the disease here in the US.
And this is a specialty of yours. You've spent a lot of time studying Ebola, as we were talking about, and I could imagine some people listening and saying, well, wait a minute, Dr. Levine, those countries have to have their healthcare systems, we have ours, why should our CDC be worried about that? How important historically is the American involvement in other countries' outbreaks to keeping things from getting worse globally?
Extremely important. Both American and also international organizations' involvement in countries which have weaker healthcare systems is incredibly important to prevent the spread of epidemics in those countries. And the CDC has been very involved for decades in helping reduce the spread of all sorts of different epidemics around the world, including the Ebola epidemic in West Africa. And the US response in West Africa is largely, along with a couple other countries, responsible for ensuring that that epidemic was able to become controlled and not spread and become a pandemic around the world. We already know that coronavirus has spread to many different countries around the world. Some of those countries have very weak healthcare systems, which will allow the virus to spread very rapidly and kill many more people in those countries. And we have to care about that, because if it's spreading in those countries, some of that spread is going to come back to the US as well. And we can do our best to stop it from coming back to the US by reducing its spread in those countries. Not to mention, the people in those countries and the high mortality that they'll experience from the disease.
Before we get to our viewer questions, focusing back on COVID-19 itself, from what we've seen overseas, and correct me if I'm wrong, this isn't impacting kids as much as it is older adults. Why do you think that is?
Well, I mean, I can't speculate. I know that in general, with most respiratory infections, such as pandemic flu, The population that's most affected is the elderly. People who are over 65 make up a large portion of the mortality and especially the severe illness each year, as well as people with chronic respiratory symptoms. We do usually also see a small spike in young children, especially very young children, but typically sort of healthy younger population is less affected, and if they get the disease, they don't have as severe symptoms. And I think we are seeing that with COVID-19 as well, but the data is still not out yet.
As a parent of 2 kids, though, I wondered also, the coronavirus is, as the director said on the Newsmakers program, is also the common cold. And I can't remember a time my kids didn't have a cold. So is it possible that helps in any way, that they have all that swimming around in them?
I'm not sure if I can say that for certain. This is a novel.
This is why I don't have
novel
I'm
virus,
not a
but
doctor.
I completely understand. I have a 14-month-old daughter, and she has a cold constantly.
Right.
So in general, the same things that hold true of protecting ourselves hold true of protecting our children. If they're sick, keep them home. Don't send them to school or daycare, and set up plans for how you can ensure that you have childcare available if you need to keep your child home from school.
All right, Ted, I'm going to get to a viewer question. This one via Twitter from Shaya, and probably the number one question we got was about face masks, and she asks, assuming they help, does Rhode Island have an adequate stock of face masks for state hospital use and private purchase? I don't know if you can answer the latter part, if you have a grasp on the stock here in Rhode Island, but answer that if you can. Maybe answer the first half of that, which we touched on a little in Newsmakers, but about the efficacy of face masks.
Yeah, so there's no need for a face mask if you're healthy and have no symptoms at all. The face mask is really made, when we put it on patients in the hospital, for instance, to keep them from spreading it to other people. So when they cough, when they sneeze, the particles get stuck behind the mask. And if those droplets can't reach another human being, then they can't spread the disease to another human being. If you're healthy, though, you don't need a mask. And the worldwide supply of masks is strained. I can't speak specifically to Rhode Island, but I know worldwide there's a shortage of all different types of masks. And so we need to make sure that only those who really need it, i.e. people who are sick in the hospital and the healthcare workers taking care of them, should have access to those.
In fact, you told me off air that you've heard from folks you work with who are in Africa, I believe, that the panicked buying of masks for coronavirus is harming their ability to get masks for the Ebola outbreak.
That's exactly right. In fact, the team that I work with fighting the Ebola epidemic in Congo right now has found out that their supply of masks is threatened because of the coronavirus outbreak.
Ebola makes me think about vaccines, and I remember when there was such alarm about Ebola, I think in 2014, and then there was a lot of relief because it seemed like the vaccine was developed quite quickly in that case. Was that unusual, or could you see the researchers having surprisingly quick success to find a vaccine for this novel coronavirus?
Well, the time between identification of a new disease and production of a vaccine has been decreasing, and that's really good news. In fact, I heard that they already have some candidate vaccines for COVID-19, for the SARS-CoV-2 virus that causes it. It still takes at least a year to do appropriate testing on the vaccine and ensure that it is effective and that it's safe before it can be licensed for regular use. So we're still at least a year away from having a vaccine in use, but certainly it could happen that quickly within a year or so.
Our last viewer question, and this speaks to capacity. People are really freaking out about the capacity here in Rhode Island, I guess everywhere. If we get hit hard, and Janine wrote us, if 100 beds were needed to isolate patients with pneumonia, where would they be? In one hospital wing, spread around to multiple sites? Any idea how that would work? It's probably a better question for the director, honestly, but do you have any thoughts as someone who kind of studies epidemics?
Maybe what's best practice would be another way to look at it.
Yeah. Well, I think that for the most part, developed healthcare systems like the United States have a bit of excess capacity, and so can handle a surge in cases, and sometimes it means things like reducing, elective surgeries, for instance, so those beds that would have gone to people having an elective and not immediately necessary surgery can go to a patient who has, respiratory symptoms from a novel virus such as this. It's only in very rare cases that you actually need to build new facilities to house infected patients. And who knows where this is going to go, but I wouldn't think that is going to be a particular problem here in Rhode Island.
All right, we got to let you go. But final question for you, and I asked this of Dr. Sooner. What are you doing personally to prepare?
So number one, I am psychologically preparing myself for the fact that this epidemic is going to get worse, that we're going to have more cases in the US, we're going to have a case in Rhode Island. I'm preparing myself to watch your news show and hear about the first cases in Rhode Island so that when it happens, I'm not scared and I'm not freaked out. And that I think is really important for everyone to think about. Number two, having backup plans for if you get sick, staying home from work, figuring out how to telework. If your kids get sick, making sure you have childcare so that they can stay home. Because the most important way that we can prevent spread of this disease is by people who are sick staying home and not spreading the disease to their coworkers, their schoolmates, and their neighbors, et cetera. Finally, taking specific measures like washing your hands frequently, avoiding shaking hands with anybody who could be sick, avoiding anybody who's coughing. Those very simple, basic measures can be used to protect yourself.
It's amazing, but washing your hands, the thing our moms taught us as a little kid, is still is so important to this, it sounds like.
It is the most effective way to prevent yourself from getting this disease and to prevent others from getting the disease from you. And all other types of infectious diseases as well that are spread person to person. So we should definitely be doing that.
Dr. Adam Levine from Brown University, thanks very much for sticking around. And you can see continuing coverage of the coronavirus concerns on the website right here on WPRI.com. We have the latest headlines, a map of confirmed cases from the United States, plus important information from the CDC. I want to thank you for watching this WPRI.com Digital Extra.